Welcome to the Edelheit Experience, a compelling conversation about revolutionizing health and well-being, bringing you rich stories and lessons learned from leading corporate executives. Now, we'd like to introduce your host, Jonathan Edelheit.
Welcome to the Edelheit Experience. This is Jonathan Edelheit. I've got another great guest with me today, Kate Brown, who heads up innovation over at Mercer. Kate, thanks for joining us.
Yeah, thanks so much for having me, Jonathan.
So, Kate, give us some brief background about who is Kate Brown?
Oh, well, I don't know how interesting the answer to that question is, but so as you mentioned, I lead the Center for Health Innovation at Mercer. So that's within our US health business. I have been in an innovation role for Mercer for about 4 years now and leading that practice for 2. Prior to that, I was a total health management consultant, which, in Mercer parlance is kind of population health management from the employer side of things. And before that, I was getting a master's degree in kinesiology because I thought I wanted to be a college soccer coach. So I've had a bit of a weird wandering career journey so far.
Is there soccer coach opportunity still out there for later on in life, or is that...
Yeah, never say never, right? Just not probably what I want to pursue professionally at this point.
So, being involved at the heart of innovation, I have to assume, though, you probably get inundated every day with people coming to you with what they're calling innovation, right? And, is there a certain percentage of things being called innovative that you find actually are innovative that interest you and you want to take the time to look at?
Yeah, I don't know if I could quantify it in an exact percentage, but you're right. There's a lot of maybe overuse of that word, or maybe just different perspectives on what is innovative versus what is not. I would say that I think my interests have shifted over time. When I first stepped into the role, just a lot of it was really incremental innovation, to be honest with you, like working within the healthcare space and particularly within employer-sponsored healthcare space. Incremental innovation is often what can get done. And so focusing on that from an innovation perspective allows us to get some quick wins, which can always be good from a professional sense. But as I've gotten more into the role and kind of more deeply understanding of the healthcare ecosystem overall and the role that the employers play, I've become much more interested in the bigger, more disruptive areas of innovation that I see.
Now, with that, obviously, we've had this acceleration of virtual care, and this has, become a big area for you of where your passion lies. Tell us what's going on in virtual care and, what does it really mean?
Yeah. So, I think since the coronavirus pandemic, obviously anybody and everybody who kind of has paid attention or even has lived life during this period has probably had some sort of interaction with a virtual care experience. We've seen huge upticks in the use of telemedicine and virtual visits for seeking healthcare, right? And so I think that that's kind of a good thing that came out of COVID is that we've realized that you don't necessarily always have to be in a brick and mortar setting in order to receive appropriate care. But I think what's happening right now is everybody's trying to figure it out, right? There was a lot of kind of older infrastructure that was in place prior to coronavirus that was quickly kind of flipped and used to deliver virtual care. And in some cases, that's great. In other cases, it really needs to be re-examined and kind of not built from scratch, but maybe built from close to scratch in order to get it right and really deliver a good virtual experience. So that's kind of what's happening on strictly the traditional telemedicine side. But we've also seen that virtual care is starting to encompass things that employers previously would probably call point solutions. So when you think about the different digital health companies that are focused on specific conditions or specific condition management protocols, all of that kind of also bleeds into virtual care delivery. And so I think it's just a really interesting time right now. And as I was mentioning, kind of being interested in the bigger disruptive opportunities for innovation that would impact the employer space. This action around virtual care is I think really where it's at in terms of the next several years of opportunity for innovation, opportunity to make the system better, and ultimately to get better access to more people within the healthcare system.
What's the difference between virtual care and virtual first care?
Love that question. So if you read about virtual care, you'll see a lot of different terminology. And in part, that's because, as I mentioned, everything's kind of getting formed right now, right? There aren't a lot of formal definitions around this space. And so everybody's trying to kind of plant a flag and figure out what is virtual care, what is virtual first care, et cetera. Virtual first care has now a formal definition that was put together by a group called Impact. And that's a coalition that was formed by the Digital Medicine Society and the American Telemedicine Association. And Mercer is involved with that group. But the important definition there is that virtual first care is medical care for individuals or a community, accessed through digital interactions where possible, guided by a clinician, and integrated into a person's everyday life. So when you think about that definition, which is beautiful, right? Because it's so succinct, it's only just one sentence, it's wonderful, but it really describes a lot of the things that are already happening in digital health. And the struggle today is that most of those companies that I was mentioning that are delivering virtual care, but maybe for a specific condition, the struggle is that they're all fragmented. So that's what's kind of going on, Jonathan. And I think important around the terminology that this concept of virtual first care really does have a formal definition at this point.
So you just mentioned fragmented. I think that's very, very key, right? Maybe you could share, what does that fragmentation mean, and kind of the impact, if I'm going to pull a pun on the definition you just gave, but the impact of fragmentation in care delivered virtually.
Yeah. Nailed the pun, by the way.
Thank you.
I'll take it from a patient perspective, because I think that is something that everybody can relate to, right? Today, if you've got, whether it's through your employer plans, whether it's through consumer channels, maybe you're on some sort of public option plan through the ACA or through Medicaid or Medicare, regardless, you have lots of different potential channels for engaging in your healthcare. But let's take the employer space. So a patient who has coverage through a carrier, but also has point solutions or digital health solutions for managing diabetes, cardiovascular issues. Maybe they also have behavioral health needs. The employer might have set it up so that they have a different company that's specifically focused on each of those conditions. And if you're a patient who has those comorbid conditions altogether, you don't necessarily know what the right front door is for you to get all of your needs met. And that fragmentation comes out because you might get into one front door, but not be able to go to a side door into a very relevant solution for you. You might have to kind of go back outside and find a different door. So that's kind of what I meant, Jonathan, by the fragmented piece, at least from a patient perspective.
Outside of the frustration from, let's say, the patient experience of having to, potentially use different solutions for different conditions they have, what other, are there issues with potential bad outcomes, complications, medication being diagnosed, and because it's not all in the same system and it's multiple different companies, that things aren't being catched? What is the challenges or risks there?
I think all of those are potential risks. Certainly, if the data isn't shared across those entities on a patient-specific basis, you run the risk of poor outcomes, mismanagement from a clinical perspective, medical mismanagement. I think that it's kind of interesting, and this is a direction I don't know that we need to take the conversation, but a lot of those issues could actually be solved if health records were actually owned and organized by the patient rather than by the entities that are managing that individual's health or specific condition. That's a little bit utopia. That's not how it exists today. Today, all of the data exists really in silos. And so if the data is not shared appropriately, and if there's not usually somebody looking holistically across the patient, I think all of the risks that you mentioned, Jonathan, are possible. The other thing that's important from an employer perspective, and to a certain extent, a patient perspective, depending on what plan they're enrolled in, is potential duplicative cost and spend, right? If you are seeking care within one entity for your diabetes, but you need to go somewhere else for your behavioral health care, maybe as a patient, you don't care because the coverage you don't really see what the cost is behind that. But an employer certainly should care, right? Because if they're getting services from one provider that's being duplicated in another place, that's duplicative cost, and that's not good for the system.
Outside of the duplicative costs and the different, the issue, other inherent issues, medical records, et cetera, Is there like, have you seen issues where the patient maybe doesn't go forward with all the care they should because they've got to keep, you know, going to different solution providers versus if it was kind of integrated or offered by one?
Yeah, for sure. I think that like non-compliance, if you will, is definitely something that we see within the consumer or patient population. And it's really driven off of both level of effort and confusion, right? If you don't know where to go when you need a certain type of care for a specific condition, you're more likely to just not take action at all, right? And or you get kind of lost in the process of trying to navigate it all. And certainly there are solutions out there that are trying to stitch those point solutions together and really create a better navigated experience and a concierge level experience. And to some extent, we've seen success with those, but that definitely is a major risk in sort of this fragmentation of the ecosystem, is that people get lost and people kind of hit barriers and they don't overcome them oftentimes.
Are there, is there a is a majority of the, like, let's say virtual care solutions, are they fragmented and not integrated? Like, how big of a problem is this, where organization need to look at, doing an inventory of like who's doing what internally, and like, is this a problem? Like, where would they even start?
It definitely could be a problem. And I would say that any employer that's got multiple vendors should do an audit, should do an inventory and understand how their vendors are working together, because potentially, yes, it can be very fragmented. That being said, I think that most partners in the ecosystem, at least the ones that I've been exposed to, are making good faith efforts to integrate, particularly on behalf of their employer plan sponsors. So it's not for lack of want or trying. It's oftentimes just that a lot of these companies are relatively new and don't have the infrastructure set up such that they can easily kind of on demand integrate on behalf of some of these employers. But from what I've seen, there are a lot of good faith efforts in the market to try and integrate, to try and share the data. But it's a pretty complex problem to solve for. And for every plan sponsor, the configuration looks a little bit different.
In regards to, if I say the word innovation with this virtual solutions out there, virtual first care, is how big of a focus and how important is the user engagement side? When I look at this and what I'm thinking about from something you said earlier is, not everyone may have experienced this, but if I go to put together, if I buy a security camera like from Nest, which is Google, I take a picture of the UPC code on the back, like all the setup happens. It's super easy. Over Christmas, I bought my son this little music box called Toonies. He's a 2-year-old. And it took me maybe 5-10 minutes to set it up. I was very frustrated. I was telling my wife, I wish they were like Nest or some of these other technologies that were just, it just inherently installed itself and worked. Where is the focus that we're seeing on like how to make this something that people love using versus glitchy or not attractive? Like my son's telemedicine solution is terrible. It's still usable, but terrible compared to, my solution that I have with Florida Blue for myself personally.
Yeah, I was going to kind of turn that around and ask if you had ever had a Google-like experience in healthcare, but it sounds like maybe close.
Usually not. No, I think the closest I've gotten was just, I think, the advancements in telemedicine for some of my telemedicine visits, which has been relatively easy, different than it was 15 years ago when I started using them.
Yeah, I think that the focus on like consumer preference and consumer engagement as opposed to patient engagement is definitely an important thing that we're watching. It's something that I think that the disruptors, if you will, are probably more focused on than the traditional carrier incumbents. The reason being that they just, philosophically come from a different place. Like if you're one of these startup companies, particularly if you started in the direct to consumer space, your slant on how you attract and how you engage people is really different than if you're an insurance carrier. But regardless, I do think that for these types of solutions to be effective and to really deliver on all of the promises that they make around better quality, better outcomes, lower cost of care, and therefore better efficient care delivery, in order for any of that to happen, people have to actually use the systems and use them appropriately. So I don't think that the engagement piece can at all be undersold, Jonathan. I think also that it's interesting that you mentioned the Nest Google example and, oh, it's so easy to set up and you just know that it's going to work, right? I think that's why there's so much attention on the Googles, the Apples, the Amazons of the world getting into this space, is because they clearly have the chops from a consumer engagement perspective. And it's, I think, only a matter of time until they figure out what exactly is happening within healthcare and start to crack that nut as well. That's a big threat for the existing healthcare ecosystem, I think.
Very big threat, because I think they're very focused on just things working seamlessly and making it very easy.
Right. Which are not usually adjectives that would apply to the healthcare experience.
Absolutely not. I could see having breakfast and talking to my Alexa that has the video on it, and just saying, hey, I want to have a second opinion, I want to talk to my pediatrician, and she'd probably come back in 10 minutes with the pediatrician or something like that.
That'd be handy. Yeah.
That would be very cool. So as the virtual first care solutions intersect with traditional health plan offerings and how they've been offered in the past, what does that mean? Like, what does that look like?
Yeah. So we're starting to see this happen more and more. And again, like if you think about V1C, virtual first care, you're talking about all of digital health, right? And you're also including there sort of your typical telemedicine experience. So if your kid's got a rash or got a cold and you just need a quick virtual visit, if you think about those types of services, we're starting to see them kind of collide with the traditional health plan offerings. And I think that's really where this is going. In particular, we're seeing this emergence of something called virtual primary care, which essentially is when you access your primary care physician via virtual means. And oftentimes that primary care physician, you'll never see them in person. You'll get your care provided via an app, via video chat. And then if you need to be referred to a specialist or need to be referred for in-person care, you're directed to a physician, typically that's within a network that those physicians are already partnered with. So a lot of the carriers have made announcements about these types of plans over the last few months. So we know Aetna's doing something with Teladoc. We know UHC is launching a pilot. Kaiser is an example that's a little different because they've got an integrated delivery system with their docs being the providers themselves. But regardless, we're starting to see basically the carriers realize that the trend of the last couple of years of virtual visits, it wasn't just a blip. It wasn't just a temporary thing. It represents really a new care delivery mechanism that ultimately should be paired with the traditional health plan model that you're used to experiencing.
Should we be excited or scared of this new model?
Personally, I'm excited. I think that it'll do a lot from a convenience and access perspective. When you need to seek care today, depending on sort of what your access and what your plans look like, you probably have a telemedicine vendor that you can see for an acute issue. Tomorrow, you might be able to see a telemedicine or virtual care provider, but see the same one every time, which is kind of a nice feature for those folks who, don't have a lot of health concerns, but maybe occasionally need something, but knowing that they're going to see the same virtual care team, that their health records are all going to be there, that everything's accessible. I think that just from a consumer perspective is pretty good. It's also, it has the potential to help a lot with access. So a lot of folks, and this is not my area of expertise, but just something that I kind of keep an eye on and read up on, is access within rural settings, right? And we've been reading a lot about closures of rural hospital systems, for example. And as healthcare providers kind of move out of some of those rural facilities, there's lower access in the community, but virtual visits could solve for some of that. So I think that there's a lot of good that could come out of this. Now, I'm a little worried for your follow-up question, Jonathan, which might be what could go wrong.
What could go wrong?
Yeah. So here's the thing, like as optimistic as I am about it, and I really do think that there's a lot of good that could come out of these types of arrangements. I think we have to watch carefully and try to influence what goes on from a cost perspective. So really, cost and associated cost savings are a big unknown here. These plans are pretty new. In some cases, they've kind of been in pilot stage for a year. In some cases, they're really just launching. But what we're seeing is that a lot of the carriers are saying that these virtual first plans are going to yield savings. But we don't really have the real world data yet to back that up. And so the risk, I think, is that if these plans aren't structured appropriately in terms of reimbursement for virtual visits versus in person, and if they're not structured appropriately in terms of engaging the right folks to actually use the plans, then there's the potential that those cost savings that they're projecting don't come to pass. And certainly, we're a country that doesn't need to add any additional cost into the healthcare system. So I think that's a big thing to be cognizant of, and a big thing that we're kind of focusing on in terms of our work with these groups. The other thing, and I kind of alluded to this, is sort of the cost structure between in-person visits versus virtual visits. If not done appropriately, you could risk that being duplicative spend, right? If somebody goes to the virtual visit can't solve their problem, they get referred, and they end up basically paying twice for the same medical need. That's another case that would not be so good. And so it'll be interesting to see how some of these carriers think about addressing that. I think it's a big opportunity for bundled pricing and for value-based care arrangements, because ultimately those are shifting away from the fee-for-service model that clearly doesn't work if we have this virtual first plus in-person referrals when needed arrangement.
Should the cost be cheaper for virtual versus in person? Because I've heard, employers complaining that they feel like they're being charged the same amount for virtual as in person, and they feel like they should be paying less.
Yeah, it's a hot point of contention right now. I think you're right on the employer perspective, right? If from their perspective, if a visit is shorter and it doesn't require the same brick and mortar infrastructure, and it doesn't require the same office staff to make sure that the visit is proceeding as planned, then there are fewer costs associated with that virtual visit than in person. Therefore, they should be being charged less, right? I think the perspective is different from the provider community, right? They feel like that's still time that they're spending with patients, and it shouldn't matter whether that care is delivered in person or virtually, because the whole argument is that the quality should be the same or better. And so their perspective is probably opposite, right? They think they should be provided or reimbursed at the same rate. It'll be interesting to see how it all works out. I do think that, again, that sort of bundled pricing arrangement would be the ideal, where if you're a patient and you go to a virtual visit, that need can't be resolved. You have to go to in-person care, rather than getting charged every single time you kind of interact with the care system as it's set up today. If instead we looked at it from a holistic perspective and said, okay, for this ear infection, regardless of kind of what the touch points were, this is the rate that you paid. That's an ideal model. That's where I hope this goes to, but we have a lot of work between here and there, I think, to get there.
I'm very excited about the whole virtual primary care solution. I would be an immediate adopter personally of it, because the fact that I could deal with a doctor that I could trust and build a relationship with, and do it at the convenience of at home or at the office or while I'm traveling. I don't feel like I need to go into the doctor's office unless I need to, plus my time is valuable. And I just feel the virtual care is so much more convenient than sitting and waiting very long period of time in the doctor's office.
Yeah, it's way better to take it on your couch than to actually go into a provider office, right?
Absolutely. And especially if you, with some providers, you only get, depending on the provider, 30 seconds, 60 seconds, a couple minutes. That's a lot of time to get in your car, drive, go sit in an office, drive back, when you could just be doing whatever you need to, waiting for the call to happen.
Yeah. My favorite was I went to see a primary care physician that I had seen a handful of times, and he walked into the room and looked at my chart and he goes, "Nice to meet you." I was like, yeah, okay. This is a great relationship we got here.
For relationship is so important for me. I found my wife a doctor in a very specific specialty she needed. And then, I try to she's my advocate. I try to be hers. And so I do the research. And I found this doctor who just had amazing, medical school, advanced degrees, where he practiced all these things, had amazing reviews. And she just went like a week ago and said, I spent about 60 seconds with me, and it was wasn't even a person. And I was shocked because like I chose poorly. And I guess he absolutely had no personality too. And my wife's very easy to get along with. So it's interesting how this is all going to develop, because it doesn't matter whether you go in person, whether you do it virtually. I think having the trust and the relationship, in a doctor who knows who you are and knows your records, that's going to solve our problems, much more, and this all being integrated than the previous model that we've tried that has failed us in the past.
I think it'll also, in time, take some pressure off of the providers, right? If we can be better about managing the data and using technology to be more efficient in the delivery of care, they can spend more time with patients rather than more time on administrative capacity work, right? Like that will also, I think, have a positive impact on how the care is delivered.
Now, if we fast forward to the future, let's say 2030, what's virtual first care and virtual health plans? What does that look like for everyone?
So I don't have a crystal ball, sadly enough, but if I did have one, I would have to guess that I think every plan, at least here in the United States, is going to have some sort of virtual component. And I think excitingly, it won't just be sort of let's call them a random provider, even though it's the provider you see all the time. But I think that most brick and mortar providers will actually be the ones delivering the virtual visits. So it's a little bit of a jump from where we are today, where it's a little bit bifurcated, right? If you have a primary care physician that you have a relationship with, you probably would prefer to see that provider virtually. And during COVID, we saw a lot of that, but some of that has shifted back. I think by 2030, it'll be really upon the patient's choice, right? To say like, okay, I have this relationship with my doctor in my community, but I don't need to drive across town to see them. Let me schedule a virtual visit. I think that'll be much more commonplace. Hopefully by 2030, it kind of becomes the standard or the norm. So that's what I think. It's just like, you're going to see it be a lot more common. I think beyond just sort of like the pure virtual provider type of movement that I think we'll see some interesting stuff within digital health. In particular, we were talking, Jonathan, about the fragmentation, right? And from a patient perspective, it can be hard to know where to go when, and how do you get your care transferred amongst these different groups? And, does the data flow? Doesn't the data flow? That's all painful today from a patient perspective, but I think it's also cumbersome from an employer perspective, right? They spend a lot of time and a lot of effort managing these different entities, trying to get them to integrate, trying to create a better user experience. And I'm not sure that that's sustainable. And that's maybe a little bit controversial because the direct to employer kind of sales model is pretty robust these days, right? A lot of money is spent on digital health solutions by employers. But I could see in the next 10 years, employers kind of getting out of that game and saying to either the carriers or maybe to health systems, hey, you need to be the conveners of these different digital health companies for all of these different solutions. And you need to really build the infrastructure so that they're integrated, so that the user experience from a healthcare perspective is as comprehensive and easy as possible, rather than having, HR teams across the country try to do this same work over and over again. It just might make more sense to have the conveners of these digital health companies really sit within the health systems or the insurance companies.
You ever seen the movie Elysium with Matt Damon?
No.
You definitely have to see it. It's a futuristic movie, amazing movie. But in it, they go into these pods and basically get cured of any disease. So I was hoping you were saying by 2030, your virtual visit from home, you go into your pod, everything is solved, no problem.
That's a little optimistic. Maybe 2050, maybe we'll see that.
It's a really great movie, though. Really
Okay.
great. It's I don't know if it was for 5 or 8 years ago, but it's a more of a futuristic movie, but very good.
I'll check
Um,
it
it,
out.
it, and it also is about the disparities in healthcare from
Mm,
the poor to the wealthy, so which you probably would find very interesting.
okay, good. So I can bill my time for watching it. That's good.
Exactly, right? It's research. So,
No, but actually to that point, I do think that, remote patient monitoring is something that's here today. So that's probably something that's going to continue to increase. So by 2030, I think we'll see more of that. I don't think we'll get magical pod cures, but I do think we'll definitely receive more care at home.
now, are there other digital trends you're looking at or watching?
Totally just spoil alerted myself. Yeah. Remote patient monitoring is definitely something
Ah,
I'm watching. And in particular, combined with the trend of care at home. So this is something that has popped up much more so in like the Medicare space and Medicare Advantage than it has in the commercial population just yet. But I do think that there's this recognition that using remote patient monitoring technology enables people to receive a lot more care at home than they did previously. And that's a pretty interesting shift. And, I mentioned this earlier, like during COVID, a lot of stuff has happened at home, right? A lot of care delivery has happened at home, but it's built on sort of the older systems of care. And it's kind of patchwork together because we were responding to what was going on with the pandemic and what we had in front of us. I think going forward, the deployment of RPM or remote patient monitoring technology in a built for purpose standpoint for care delivery at home, I think that holds huge potential. Certainly, the use cases for the senior population makes sense, right? If you're an older individual, especially if there's a pandemic going on, but regardless, you may not want to be leaving your home to seek care. But even in the commercial population, like we've seen so much emphasis, rightly so, on sort of the role of the caregiver during the pandemic and the extreme pressures that are placed on parents and other caregivers. And so knowing that you could seek medical care either for yourself or for the person that you're caring for without leaving your home, that I think is a big area of growth, regardless of the population that we're talking about.
feel at all that, obviously the pandemic sucks,
Yeah.
but in your role, is there like this has like been great from the perspective of, everything has been forced virtual and remote, and now there's this mass acceleration that we've accomplished, I feel like in 10 years that, I'm sorry, that we couldn't do in 10 years, almost in like 6 months to a year. And now there's going to be this more investment and so much more advancements in remote care, virtual care than there would have been without it.
The pandemic definitely does suck. I think the thing that is maybe not the biggest, but a big silver lining from where I'm sitting is that a lot of people have realized that you can do things differently and the world won't implode. And that to me is kind of the most encouraging thing. I think that it's been a huge opportunity for us to try and do things differently within the healthcare system. And there's a lot more openness and appetite for that because the circumstances have dictated it. And so, in terms of kind of what comes next and this acceleration that you mentioned, Jonathan, yeah, I think, a lot has gotten done over the last 2 years that prior to 2020, I would have said that's what 2030 looks like. So, that acceleration is awesome. There's corresponding investment that goes with it, also awesome. But I really think that the best thing to come out of it is the fact that people are willing to try new things because they realize that when you're in a situation and you have to try new things, it doesn't work out as poorly as maybe you thought it would.
Yeah, you're willing to risk more.
Yeah.
Yeah, I completely agree with you. And also, when things are good, people don't want to try anything new. But when things are bad, right, people are much more open-minded,
Totally.
having to do things differently. If you could go back 2 years to 2019 and invest in any digital health company, which would it be?
Zoom, obviously.
Oh, good one. Which you went back 2 years ago, we even think of them as a digital health company, right? But now they are.
Well, yeah. I mean, that's obviously a little tongue in cheek because maybe they're not technically a digital health company, but it'd be good to have some stock of them for 2019. But no, I think seriously, besides Zoom, not so much a specific company that I would invest in, but really the whole sector of mental health support. I think that's another silver lining that's come out of this, right? Is that employers in particular have recognized that mental health is something that everybody has and everybody needs to manage. And so we've seen corresponding growth in that space. And that's just, I think, really encouraging to see. Ultimately, because I think in the long run, it's going to yield a much more psychologically healthy workplace. And frankly, I think that's something that we can all benefit from.
I definitely agree with that. I think that no matter who we are, where we're at, we realize the importance of mental health. We have a strategic partner, Global Healthcare Accreditation, which launched an accreditation called GHA for Business, where they're accrediting organizations for health, safety, and well-being. And one element of their accreditation is that organizations have mental health. And I'm just curious to this is there a certain percentage of companies that you're seeing that are making advancements and really moving forward in mental health offerings? Are there some companies that still aren't doing it? And I was on a call the other day where somebody said there's like 800 mental health solution providers out there. I don't know if that's true or not, but I thought, how the hell do you wade through that in making a solution?
I don't know. 800 is that's maybe a little inflated, but it's probably not far off. There are a lot of solutions out there, in part because it's gotten so much attention over the last couple of years, and there's so much money flying around in the VC PE circles, right? But that being said, I think that a lot of employers are looking at this. A lot of them have made changes. I think according to our 2021 data, it was the kind of top area of focus where employers were going to look to expand their programming. So I would say most employers are probably looking at it. Are there companies out there who still don't believe that it's important? Sure, right? You're never going to convince everybody, but there has definitely been a noticeable uptick over the last couple of years in terms of employers not just talking about it and then kind of setting it aside, but actually taking real steps to implement new programs and new policies around mental health.
How do we talk about this innovation, digital health, first virtual care? Do you think anything will change in our industry in the future where or like companies will decide to work with solution providers that are there's this big movement. I don't know if you've heard with like ESG about, companies who are, well, can be environmentally responsible, socially responsible, like prioritizing, the safety or health of their own employees. Do you think there's ever going to be a shift towards that where companies will say like, hey, this is going to be a checkbox for who we're going to do business with, or it's really just going to come down to who has the best solution?
I really like that question because it's something that has been popping up more and more within my world, Jonathan. So I do think that more and more we're going to see buyers asking questions about ESG credentials from those providers or vendors that they work with. I would say right now it's kind of early days. I haven't seen a lot of employers kind of demand that there are certain ESG metrics that their partners meet. But we are starting to get some questions from employers about certain environmental or social standards that a vendor may or may not meet. So I do think that that's on the horizon. And I think going along with that, so the folks in the decision maker seat right now may not have as high of a priority on ESG as the decision makers to come. And so I think there's another kind of shift coming in terms of both the workers who are younger, who are more activated around the topic of ESG, and there is some research to suggest that, but also the fact that some of those folks are eventually going to be in leadership seats as well, and their preferences or their sort of points of view around ESG being of importance will naturally start to filter its way into the cultural fabric of some of these organizations. So yeah, I think it's definitely coming.
Any final words of wisdom before we close it out?
If you piloted anything during the COVID pandemic and you learned something, keep doing it. Keep piloting, keep trying things, even after things go back to quote unquote normal.
I think that's great advice, right? Because at the end of the day, I feel we don't want things just to go back to normal in regards to how we're managing healthcare, right? We have to constantly innovate and improve.
Every day. That's why I get up and go to work.
I know when there's no improvement and things are the status quo, I feel like a part of me dies inside.
Yes. Well, you can't use telemedicine for that. So
No, you can't. Well, thank you for joining us. I really appreciate it, Kate.
Thank you for having me, Jonathan.